My mom, Marnie, and that's the Marnie of Marnie and Michael. She was mostly a single mom for her whole life because of my mom's mental illness, which was not diagnosed or treated until she was in her early 50s. We did a lot of moving. Even if we lived in one location, we moved quite a bit. There were, my mom and dad tried to make it work, but obviously with my mom's mental illness, it was pretty hard. So my dad kind of came in and out of our lives. They tried a few times while we were children to get back together. It didn't quite work, but they actually did eventually get back together later in life, which was wonderful. There was just a lot of instability in our life. There was, we weren't really sure where we were necessarily going to be living or who we were going to be living with or where we were going to be living. My mom's family was pretty, integral in the support system, as much as my mom would allow that support to be there. Because it definitely, when you're dealing with that sort of a situation, you need to have some sort of stability somewhere. My mom was able to, in her early 50s, kind of everything came together for her, and she basically hooked up with a team of professionals who she really, clicked with. And she was able to stick to a treatment plan, and she was able to get on a medication plan, which is a really big part of mental illness. It takes a long time to figure out what's going to work. And sometimes things shift and change, so it's just a big piece of the puzzle. But she, really turned into, obviously the person who she really was hoping she could be and who she knew she could be. I've always said that, my children got the grandma that I so knew they deserved and who she could be. And even though it would have been nice for that to happen earlier for us, to get that advantage as well, it happened when it happened. And I would much rather, have my kids only have those great memories than have to deal with, not seeing her as that healthy version of herself. And we didn't talk about mental health. The only thing I think that mostly it was like the term crazy was used a lot. There was a huge stigma for her to openly admit or say or try to deal with it. So there was just a lot of shame, and there was, a lot that she was dealing with on top of just, raising us. And she just didn't come to the place until she was older to be able to be comfortable to do it. I was out west with my boyfriend, now husband, for 7 years. So definitely put some space between us. But then when we returned back here, things still weren't very good. And my older sister and one of my younger sisters, they had already had children early, so there were grandkids in the mix at this point, and she still wasn't healthy. So we made a really big decision, and we actually pulled away from her for a period of time. All of us did it in various ways, but I literally had no contact with her for about 18 months to 24 months. And it was during that period that Mom got help. So I'm not sure if it was just the timing of everything for her, or if she realized that she needed to do something big in order to repair relationships. I also think that the grandchildren were a big part of that puzzle piece for her, because I definitely, think that she didn't want to lose those relationships. And so I'm sure for her it was just a culmination of a lot of things, but it did occur during that period of time. We actually moved here because we lost both my parents in less than 10 months of each other. It was very different for us to live in Barrie without them, and we wanted to be closer to immediate family. And one of my sisters is here in Midland, so we decided to come here. So I had been developing the company on the product side of things, and then, as I said, the social enterprise side of it, I knew it was going to be a mental health give back. In any way that I can, I've always tried to support mental health organizations, and lots of companies are doing this now, which I think is fantastic. because not a lot of people are necessarily going to just give to a charity, but if you can provide them with a product that they love, and then they know that a percentage of those profits are going towards the charity, then it's a win-win for everyone. And when I lost my parents, I still hadn't come up with a name for my company. And so I definitely knew at that point that I would be naming it Marnie Michael in their honor. I think they would be proud. Sorry. One of the things we do is our mental health blog. And my mom was a beautiful writer, and she really wanted to be a writer. And when she passed away, my dad gave me her recovery journals. And we've used those recovery journals in our blog. We've also used them, we published a mini memoir meets guided journal. And the feedback that I've had from those excerpts is just phenomenal. You know, I obviously wish she could have been here so she could see this. But she's definitely, her openness and her honesty is definitely helping other people, which I know is very important to her.